Hi, I'm Dr. Thomas McGinn, the Executive Vice President for the Physician Enterprise. Welcome to the 5-Minute Check-In. Today is November 15th, and there's a lot going on in the world of COVID. The vaccine for children has been approved, and there's new medications that have been recently studied that we need to talk about. So let's get right to it. So, of course, the big news today is that the vaccine has been approved for children between the ages of 5 to 11. And this is really important for us because if you look at this graph, you can see that the number of children in this age group is increasing. It's up to 10% now. So it's more important than ever that we have conversations with parents about how to get our children vaccinated. And today I have Dr. Jill Walsh, the chair of Pediatrics at Mercy Medical Group, to help us think about what that conversation should sound like as we talk to parents. So Dr. Walsh, thanks for joining us. And what are your thoughts about, what should we be saying to parents?
Well, I think the most important thing, there's a few really important talking points. I think the first one is that we need to let parents reassure them that this vaccine is very safe. And there's very limited risk factors of giving this vaccine to this age group. I think the other thing to realize is that patients, a third of patients who are hospitalized have no underlying comorbidities. So it's important for parents to understand that their child who is completely healthy can actually get hospitalized with this disease. When we look at the multi-system inflammatory syndrome, the important thing to know is that patients who get this are often asymptomatic or a very mild infection. And so there's a pretty big risk factor there. In general, it's also important to know that the highest risk factor for death in children is those who are less than 1 year of age. So explaining to parents that if they can get their older children vaccinated, they're actually protecting their younger siblings. As far as risk factors, really the main risk factor is a mild myocarditis, which tends to be self-limited, and it's usually an older patient. So this category of 5 to 11 really has limited risk for that. It's way less than if you actually got myocarditis from the infection itself. And there really is no issues at this point or concerns about fertility.
Well, I think you summarized almost everything perfectly there. So I think bottom line is it's a very low risk vaccine with tremendous benefits, and we cannot underestimate the benefit and the risk for our children to having COVID itself. So thank you for that help. And, I think everyone now can have a better communication with the parents about getting their children vaccinated. Thank you, Dr. Walsh.
Oh, you're very welcome.
In the past 6 weeks, there's been 2 major publications related to medications that can be taken at home by COVID patients to reduce the need for hospitalizations. The most recent publication by Pfizer is a new medication called Paxlovid. It cut the rate of admissions by close to 90%. It was a really well done randomized controlled trial with 1,200 patients, 600 in the intervention arm and 600 in the placebo arm, with about 7% of the placebo group getting admitted and less than 1% in the treatment arm getting admitted. So that makes for close to 90% reduction in admissions. Now that's on the heels of Merck's medication, an antiviral pill that reduced admissions by up to 50%. So if you look at it, we now have monoclonal antibodies, remdesivir, we have the new Merck and Pfizer medications to work with mostly high-risk patients. That, of course, is with the addition of everyone getting vaccinated. So we're making a lot of progress. Congratulations to the 32 clinics across CommonSpirit for being recognized recently by the American Heart Association and the American Medical Association as part of the 2021 Target Blood Pressure Recognition Program, where they achieved 70% blood pressure control across all of their populations. This is an amazing achievement, preventing heart disease and stroke. Another major milestone across CommonSpirit is we hit our 2 million virtual visits. What an accomplishment. So congratulations to everyone who participates in that, on the technical side, the administrative side, and the clinical side. And last but not least, I'd like to recognize the opening of a new clinic at Baylor St. Luke's Medical Group. It recently celebrated its grand opening of a new primary care center and convenient care in Richmond. It's 10,000 square feet with 20 patient care rooms, open 7 days a week. So congratulations to the new team down there. So thank you for joining me at the 5-Minute Check-In, and I'll see you in 2 weeks.